Dear students, in this lecture I will cover antihypertensive drugs. It is the most important topic of pharmacology. In this session, I will cover the introductory part and types of hypertension, normal blood pressure regulation, classification of antihypertensive drugs, clinical manifestations, mechanism of actions, and treatment of hypertension. Let's start with the understanding the basics of hypertension and as we all know hypertension is related with blood pressure and blood pressure is the pressure of blood pushing against the walls of your arteries and arteries carry blood from your heart and to the other parts of the body and blood pressure normally rises and falls throughout the day. But it can damage your heart and cause various health issues if it stays for a long time. And hypertension is defined either at the greater than their ranges, like the systolic blood pressure is more than 140 mm of Hg and the diastolic blood pressure is more than 90 mm of Hg. In simple words, we can say hypertension is also called high blood pressure, which means blood pressure is that is higher than the normal range. And hypertension is a condition in which blood pressure is increased from their normal range and the agents that reduces the high blood pressure is called as antihypertensives or antihypertensive drugs. In this picture we can see hypertension is defined as the systolic blood pressure is raised from their normal range is more than 140 mm of Hg and diastolic blood pressure is more than 90 mm of Hg. And now move on the next slide. This is the classification of blood pressure for adults and this classification is based on the recommendation of the 7th report of the Joint National Committee on Prevention, Detection, Evaluation and Treatment of High Blood Pressure. And this classification is for adults uh, which age is 18 years or older as follows in this table. And we can see in this table blood pressure classification as normal, pre-hypertension and stage 1 hypertension, stage 2 hypertension and hypertensive crisis. The range of systolic blood pressure and diastolic blood pressure is also noted down in this slide. And one more fact with this. In 2017, American College of Cardiology, which is known as ACC, and American Heart Association AHA, eliminate the classification of pre-hypertension and divides it into two levels, and which was accordingly elevated blood pressure with a systolic pressure between 120 and 129 mm of Hg and diastolic pressure less than 80 mm of Hg and stage 1 hypertension as in this table between 130 to 139 mm of Hg systolic blood pressure and diastolic blood pressure of 80 to 89 mm of Hg. Now move on the next slide. The types of hypertension and in this classification we can see hypertension may be primary or secondary or essential and non-essential and in case of essential or primary hypertension which may develop as a result of environmental or genetic causes means a disorder of unknown origin which affecting the blood pressure regulating mechanism And in secondary hypertension, which has multiple etiologies like renal, vascular and endocrine causes involved in the secondary hypertension. There are various environmental factors which directly or indirectly involved in hypertension. It may be stress, it may be obesity, it may be increased or high sodium intake and smoking. And primary or essential hypertension accounts uh, 90 to 95% of adult cases of hypertension, and secondary hypertension accounts for only 2 to 10% of cases. Move on the blood pressure regulation, and this regulation is based on hydraulic equation. And in the first point we can see blood pressure is determined by cardiac output, which is denoted as cardiac output (HCO), and total peripheral vascular resistance as PVR. And according to the hydraulic equation, arterial blood pressure is directly proportional to the product of blood flow as cardiac output and the resistance of blood through the precapillary arterioles as PVR. So it means blood pressure equal to cardiac output into PVR. And blood pressure is controlled by baroreceptors. In the first point we can see physiologically cardiac output and peripheral vascular resistance is maintained minute to minute by, or we can say moment to moment of cardiac output and peripheral vascular resistance, and it exerted at three anatomic sites, and these are arterioles, post capillary venules and heart, and kidney is also involved as a fourth site, and post capillary venules is also known as the capacitance vessels, and baroreflex humeral mechanism and renin-angiotensin aldosterone system regulates the above four sites as already I told. And baroreflex is mediated by autonomic nerves, which is a combination with humeral mechanism including the renin-angiotensin aldosterone systems, and all the antihypertensive act via interfering with the normal mechanism. Now move on the clinical manifestations of hypertension, and in this slide the first point is the clinical manifestations of hypertension varies greatly, and we can experience the people with high blood pressure can experience symptoms like severe headache, chest pain, dizziness, difficulty in breathing, blurred vision, nausea, vomiting, and other vision changes and anxiety, and so on. In case of headache, the red blood cells carrying oxygen is having a hard time to reaching the brain because of constrict vessels, and that cause the headache. And in case of chest pain, and the chest pain occurs due to the decreased oxygen levels, and in case of dizziness, the low concentration that reaches the brain and that cause the dizziness. And in case of blurred vision, and there are too much constrictions in the blood vessels of the eye, and that red blood cells carrying oxygen cannot pass through, and this causes the blurred vision. First we will discuss about diuretics, and diuretics are further classified into thiazides, high ceiling diuretics, potassium sparing diuretics, and the example of thiazides are hydrochlorothiazide, chlorthalidone, indapamide, and high ceiling diuretics are as furosemide, and potassium sparing diuretics such as spironolactone, eplerenone, and amiloride. And thiazides, diuretics such as hydrochlorothiazide and chlorthalidone lowers the blood pressure initially by increasing sodium and water excretion. And thiazide diuretics can induce hypokalemia and hyperuricemia and to lesser extent hyperglycemia in some patients. And loop diuretics, these are the inhibitors of epithelial sodium transport at late distal and collecting ducts, or antagonizing the aldosterone receptors and reduce the potassium loss in urine. And aldosterone antagonists have the additional benefit of diminishing the cardiac remodeling that occurs in heart failure. Now move on the potassium sparing, and these loop diuretics like spironolactone, amiloride, torsemide, bumetanide, and trimetrine act promptly by blocking sodium and chloride reabsorption in the kidney, even in patients with poor renal functions or the patients who have not responded to thiazide diuretics. And loop diuretics cause decreased renal vascular resistance and increase renal blood flow. Now move on the renin-angiotensin system inhibitors. These are further classified as ACE inhibitor, and the examples are captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, and so on. So the ACE inhibitor are recommended as the first line treatment of hypertension in patients with a variety of compelling indications. It includes the high coronary disease risk, or the patients having history of diabetes, stroke, heart failure, and myocardial infarction or chronic kidney diseases. And ACE inhibitors are also responsible for the breakdown of bradykinin, and this is the peptide that increases the production of nitric oxide and prostacyclin by the blood vessels. And both nitric oxide and prostacyclins are the potent vasodilators. And now move on the direct renin inhibitor, and these direct renin inhibitor consisting a single drug aliskiren, and this aliskiren this aliskiren is a selective renin inhibitor, and it directly inhibits renin and thus acts earlier in the renin-angiotensin aldosterone system than angiotensin converting enzyme inhibitors or angiotensin receptor blockers, and it lowers blood pressure about as effectively as angiotensin receptor blocker, which is denoted here as AT1 blockers, and ACE inhibitors and thiazides. And aliskiren should not be routinely combined with an ACE inhibitor or angiotensin receptor blocker. And one more thing, aliskiren can cause diarrhea, especially at higher dosage, and it can cause cough and angioedema, but probably less often than ACE inhibitor, and it is contraindicated in case of pregnancy. Now move on the renin-angiotensin system blockers and sympathetic inhibitors, and these sympathetic inhibitors are further classified as beta-adrenergic blockers, and these having more common drugs like propranolol, metoprolol, atenolol, and alpha plus beta adrenergic blockers are labetalol and carvedilol, and alpha adrenergic blockers are prazosin, terazosin, doxazosin, phentolamine, and phenoxybenzamine. And in central sympatholytics, the drugs are classified as clonidine and methyl dopa. If we talk about beta adrenergic blockers, and these blockers are the mild antihypertensives, and do not significantly lower blood pressure in the normotensives. And in case of stage 1 hypertension patients, and 30 to 40% beta adrenergic blockers are used as a single. And the drugs are, I already told. And the drug is propanolol. So propanolol is the first beta blocker shows effective in the hypertension and in case of ischemic heart disease. And propanolol is largely replaced by the cardioselective beta blocker such as metoprolol and atenolol. Now move on the vasodilators, and the drugs are classified as vasodilators as hydralazine and minodoxil dioxide and arteriolar and venodilators as nitroprusside sodium. And as a vasodilator, hydralazine and or dihydralazine and minodoxil not used as a primary drug to treat hypertension. And these vasodilators act by producing relaxation of vascular smooth muscle and primarily in arteries and arterioles. And in results, these drugs decrease the peripheral resistance. And these both agents produce reflex stimulation of the heart, and in results, the competing reflexes of increased myocardial contractility and heart rate and oxygen consumption. And the hydralazine is an accepted medication for controlling blood pressure in case of pregnancy induced hypertension. And now move on the